it's not going to, it's a process, and which might take some time to, and we can see here different number, 1, 2, 3, 4, different stages. We have been putting some names. Generally, when we initially start to perceive tinnitus, is like this is awareness phase where we look online, but where we can freak out also about what is this sound that we hear. This allowance, and generally this is probably the most challenging step to go through. Like it's a stage where we accept the presence of the sound and we accept that it's a benign sound. Accepting that the sound is present is probably going to be the thing that is going to make the most change in your process. The more we fight it, the more it gets back to us. The more we try to eliminate it, the more we basically think about it. And then generally, when we get through this acceptance phase, we feel that we don't need to basically get rid of it. And sometimes it has a secondary effect on basically sleep, meaning that during the day, if we have a better day, we can also sort of like have less worry when we go to bed, and it's impacting step by step, slowly add this modification which allow us to also get better sleep, and then after get back in our acclimation phase. And the acclimation phase is the moment where we start completely filtering out the sound that we hear. And I love to take the analogy to smell, or like all our sense. So this is something that we do naturally. And I would love if we could virtually, it's something that we cannot do. We can transmit the sound. But if I was changing you virtually, if, for example, if I was putting Tim in Tracy's room, and if I was putting Dana in Stefan's room, and Sharon in Mark's room, if you were entering the room, you will smell that the room where you all are, there is a smell. But because you have been in this place for so long, you don't smell anything anymore. This becomes like a neutral smell, meaning that when you enter your room, I'm sure that when you enter your house, I'm sure that you don't think that it smells anything. But if I was now virtually placing you in someone else's room, and I was asking you, do you think that it smells something? You will probably say, yeah, but I think it smells something. But with time, if we were leaving this room for, let's say, 10 days or 20 days, then after some time, you will feel that, okay, it doesn't smell anything anymore. It's not that the smell disappeared, but it's just that our brain recalibrated. And considering that the smell is not, this room, there's not something any threatening or anything which is, our brain is naturally going to eliminate signal which are continuously sent to our brain. And so from an evolutionary point of view, it's part of how our brain functions. Our brain is able to filter out irrelevant stimuli. So because you have been in this room for X amount of days, X amount of months, X amount of years, your brain feels that, okay, this is a normal, it becomes a norm, and then at some point it's going to be completely filtering out to the point where you think that this is normal and neutral. And the same thing that happened with smell is going to happen with sound. So meaning with time, it's not that there is no smell in your room, and it's not like there's not going to be any sound, but it's just that with time, your brain is going to completely filtering it out. And acclimation means that we just activating a function that you already, which is already inbuilt in your brain. So it's something that we know that any human on Earth will be able to do naturally. Sometime before, because we are scared, because it's creating, we are worried that we're not going to be able to do it, or we don't know that we are capable to do it. And then there's certain things that can stop habituation to happen. And it's what we are doing here during this course, is like trying to learn these techniques that help us to get back to a place where we can basically filter the sound. And step 4 is really this moment where we feel that, okay, at the end of the journey, you're going to see that, okay, you can relax again. You can, and you don't need to think about this sound anymore. So probably from time to time, like initially you're going to feel that is a lot of percent. Basically, it's taking a lot of your energy, a lot of your brain energy to process a signal. And with time, you're going to see that the amount of time and the amount of energy you spend to treat the signal is going to decrease to the point where it's going to become insignificant. Literally, you're not going to think about it, potentially going to think about it once a month, or once each time you meet me, for example. I'm a very good trigger to make you think about it, because unfortunately I'm linked to the condition. So like at some point you will not want to see my face too much. Like it's good to for 12 weeks, or like for a little bit more time, but at some point you will feel, okay, yeah, I don't need Fabrice anymore. It's fine. I'm in control. And it's where when you're in stage 4 that you will be able to live your life fully and normally. But I wanted to ask you here, you can see these ups and downs, and importantly, in the journeys, there's always going to be good days and bad days. And it's really important to remind yourself that even though you feel that you are here in a bad day, you need to remember the progress you have been doing. And this graph is very linear. It looks like it's going always up. Sometimes it feels that we are really down, and meaning that it feels that this downtime feel like lower than we have ever been sometime. And we could have sometimes what we call spikes, and that happen. But always remember that following a downtime is going to be it's going to go up again, and it's going to improve again. And I wanted to ask you, here you're going to see in this group, we are all going to be at different stages. And could you write in the chat, and I'm going to try to activate the chat here. Here is the chat. Could you write in the chat where you feel you are in this journey? Because what I want to see is we probably all going to be at a different stage.
The number on the counter, 30,000 kilometers, but the rest
Team saying.
Is the chat?
Yeah. So here, did everybody find the chat? I think so. Tim found it and did write. So it's going to be easier for us to interact this way. Sharon said 3 most days, and it's normal to say most days, because this variation can definitely happen, that where we feel that we go from a 3 to sometime it goes back to a 2. Mark saying I'm a level 2, so, and it's probably level 2 is the most challenging part, but when you're going to get through the allowance or the acceptation phase, you're going to see that getting into the acclimation phase, then you start to have again good days and more good days. Mark say 3.5, and I like the 0.5 also, because I can imagine it's not that we are exactly in one stage. It probably means that we feel days where we feel completely in achievement stage, and other days where we feel, oh, okay, I don't think that I fully acclimate yet. Great. But what I wanted to show you, we are all at different place in our journey, but all together we're definitely going to get to stage 4, and you're going to see that I want you to be convinced and reassure that you're all going to get to stage 4. And meaning stage 4 is this place where tinnitus appear only once in a while, once every couple of months. If I asked my dad when he thought about his tinnitus last time, he would probably tell me, even though it has been very, very challenging for him, he will tell me like maybe a few weeks or a few months ago. And Max is telling I was at level 4 weeks ago. And I think it's really important to know that it's possible to reach level 4, but having what we call a spike. So this can happen, and it's very common. And meaning that this is a temporary moment in our life where we feel that, and it can be because of many things in our life. It could be stresses, so like some things that have been stressing us, presence, and stress is probably one of, from a scientific point of view, the factors that we understand the best. We know that stress has an impact on how we hear the sound and how it's impacting us. There's other factors, unfortunately, that we don't understand, in the sense that is the diet that we have has an impact on how we hear the sound. There's no really any evidence that's saying that, okay, if you have this diet, you're going to get better. No evidence there. There's a lot of factors which are unfortunately not really understood yet, in the sense that we can have an increase, and meaning that we can have a bad day sometime without understanding why we have a bad day. And that's okay. And what I want to say is, like, in case it happens to you that you don't understand exactly why there is good and bad days, there's a lot of, for many of us, it is the case. So, and it means that when it happens, if you have a bad day, it's not often to always wanting to completely understand why. It's also going to be about understanding that it can happen, but also moving on, that saying that, okay, tomorrow is another day and it's potentially going to be a good day. And generally it's what's happening. So not being too worried when a bad day happens. Now today, so on the habituation stage, like what I wanted, and if we get back to the smell, like try to imagine that this gold line here is an indication of smell. In the smell in your room, there's days where potentially you're cooking is going to be more smell. For example, the smell of, like, if you cook a curry, there's an increase of smell. And then there's days where there's a decrease of, for example, just the smell of your room. Over time, the way you habituate, in case you were entering a new room, it's not that the smell disappears. It's just that your brain is able to filter out what is happening. And it is the same thing that happened with hearing. The tinnitus is not going to disappear. It's going to increase or decrease. It's going to be a variation. But over time, the green curve here is telling us that the amount of distress that we have linked to the sound is decreasing largely. As Mark said, it could be a spike, meaning that there is an increase of the distress, but over time this is going to get back and we're going to be able to lower the distress created by the tinnitus. And one of the things that I want to talk about today is more like trying to understand what is tinnitus. Why do we hear as a sound? And understanding it will hopefully help us to sort of like see it really as just a benign signal. So here is like an image of the ear. You get the external ear. Here the sound's going through the ear canal. So this is a pinna, and it goes into the ear canal. Here we got the tympanic membrane, which is capturing the sound. It's like so it's just a membrane which is capturing the sound. And then we got some ossicles here in the middle here. which is transmitting the sound up to the cochlea. And the cochlea is a hearing organ. So it's like a snail. So this is the cochlea, and we're going to enter the cochlea in a minute to see how it's the structure of the cochlea. And this is a balance organ here. We call, so like these three semicircular canals, which basically help us to for balance. The signal here from the cochlea, there's an auditory nerve, and the signal is sent up to what we call here the primary auditory cortex. So this is a center in the brain which is basically capturing the sound. And from there, the sound is going to be transmitted to other part of our brain, which are going to, so the front part of our brain is taking decision, and then we get the limbic system, which is basically having a link with emotion. So from this point, we're going to take decision, and we, for example, we're going to compare the sound we hear with previous experience. So we're going to make our memory work, but the sound that we hear here, we're going to interpret the sound in a different way, and this is going to be processed in other parts of our brain. So this is a short video that, let me, the sound is entering the external ear, so this is the eardrum, the ossicle, and it's basically going to activate the cochlea. Then there is this is the cochlea, and inside the cochlea we have it's basically a snail, and inside the snail we're going to see that there is what we call the hearing organ, which is called the organ of Corti. In the snail, it's organized like a piano, so you can see here the high frequency at the base, and the more you're going up inside the cochlea, and the more you're going to go to the low frequency. The low frequency is called at the apex here. And inside the organ, so there is some small air cells here, and this air cell can be damaged. So you can see on this image here, you can see like small, very tiny cells. We call them the stereocilia. And these are the cells that are going to be able to capture the sound which is transmitted to the cochlea. And from there, you can see here the auditory nerve. And the auditory nerve is going to send the signal up to the brain. In case of hearing loss, when we are losing hearing, in certain cases, we lose the stereocilia. You can see that this cell, compared to the previous picture, some of these cells are missing. And in certain cases, when we are missing the cells, the stereocilia cells, it means the signal cannot be transmitted anymore to the auditory nerve. And you're going to see that this is going to have an importance afterwards for tinnitus. So here are like inside the cochlea, like these are normal air cells. These are air cells which are slightly damaged, and it can be damaged by sound, can be damaged with aging, and it can be damaged sometimes by drugs. There's certain drugs which can basically damage the air cells. When the air cells are disappearing, then the signal cannot be transmitted, and then there's a problem which happens at the synapse level. So this is the cells which are at the top that we were seeing earlier. If this air cell disappear, there is certain case where they are not going to be transmitting, and what we call, this is a synapse here, and this is a neuron which is basically going to transmit the sound higher up to the brain. And in certain case, we can see we get like 3 types of fibers, the 1, 2, and 3. And these 3 different types of fibers have different roles. So the number 1, they are encoding for the soft sound. The number 2, they are encoding for the sound which are in the so I would call middle loudness. So like it could be speech level sound, for level 2. And level 3, they're going to be high intensity sound. So depending to the intensity of the sound, this specific cell is going to send a signal higher up. And what can happen in certain cases, for example, if you get exposure to noise, it can be that if we, so this is like the synapse that is transmitting the signal higher up to what we call the central nervous system, or the first center is called the cochlear nucleus. And if we get exposed to noise, it can impact this too much release of neurotransmitter, which can make that this is a button which can explode. And then you're going to see a short video how this works. Basically, the sound is, this is stimulation, auditory stimulation is stimulating. And at this point, when there is activation, this button is basically impacted. And then the signal, let me put back. Because this button, which is receiving normally the neurotransmitter, is absent, then a signal is going to be sent, and it's going to be the presence of a sound that we're going to hear. When the button is disappearing, in most cases, there's a regeneration of, like this button, you can see new neurons which are growing. And growing to the point where, let's say, if we go to a concert and we got exposed to noise for 3-4 hours, this button can explode, but then it can regrow and regrow to the point where a new button can reappear. And you can see this is what we call we measure the electrical activity at this specific, so it's an action potential. And you can see that this curve looks quite similar to this curve. There's a slight change, but in certain cases, we can regrow these cells, and then in the sense that the tinnitus can disappear. And there's certain case where this button, unfortunately, doesn't reappear, and where the sound becomes constant. Now, I wanted to show you in the nerve what we got. We got random activities, and we call that stochastic activity. So it's like the neurons, they are firing randomly, and this is just a normal property of the neuron. And when there is no sound, our nerves are basically firing, and you can see that all these spikes here are representing this random activity. And from what I showed you earlier, you can see like 3 kind of fibers. And these fibers, so the red one are encoding the low intensity sound, blue one, the medium intensity sound, and green one, the high intensity sound. We're going to see that they have different spontaneous activity. So this is inside the cochlea. The signal is sent here, and the signal is sent on 3 different nerve. And I'm not sure if I'm sharing the sound, so let me, I'm going to reshare my screen with share sound. So we see the fibers. We're going to start with the low intensity sound, and we're going to see the spontaneous activity of, the high intensity. So this is a spike, and you can see there's low number of spikes, and this for the high intensity sound. Then we're going to get the blue one, which for medium intensity sound, there's more spikes. And then we get the low intensity sounds, which have more spontaneous activity. And generally what happens, we all have this different cause, but what we see here, for example, this is activity in case there is no sound. This is a neural activity in case there's a word which is said, for example, the word tree. If you say tree, then your nerve is going to fire there. And there is in the spontaneous activity in case you hear crickets. And now I want to basically show you that when you hear the sound, what is happening generally. So here's the normal hearing if we hear silence. In case we have a hearing loss and we hear silence, there's a little bit less spikes. And in case we hear tinnitus, basically there's an increase of the spontaneous rate inside the nerve when there is no activity sent to the cochlea. And then when we say like, this is just a benign stimulus, when we understand that actually the sound we hear, it's just random clicks that we hear inside the signal. It's not something dangerous, but it's something that is happening inside the nerve. Then we can basically try to start to say, okay, understand that this is not something, it just like spikes, some spikes happening. Now what I wanted also to ask you this question, when we experience tinnitus, we often experience sensitivity to sounds, meaning that, and we call that hyperacuity or hypersensitivity to sounds. And the reason is, so you can see this is a level in decibels. So you can see from 0 to 20 decibels, which is a very low intensity sounds. This has a red fiber which are firing. So if you send a sound at 10 decibel, which is very soft, there's only the red fibers here which are going to be activated. The blue fiber are not activated at all, and the green fiber not activated at all. They only get activated from 50 decibel on. Generally, what's happening when we experience tinnitus, it's the green fiber which generally don't fire too much, we start to fire more. And what happens, because these fibers don't work very well anymore, sometimes we can get more sensitive to soft sound. We get more sensitive to sound in general, meaning that when we get in a loud environment, we feel that it's too loud, if it makes sense. And so what I want to basically show you here is like trying to understand why there's a certain case where we feel that we have a hearing loss, we hear less the soft sound, but on the opposite hand, we feel more sensitive to the loud sound. And so if we look at the physiology, basically we understand that because it's just certain fibers who can potentially get impacted, this creates this hypersensitivity to high sound, and this creates the tinnitus that we hear. Again, this is there's multiple kind of tinnitus. Tinnitus can be created, certain case can be influenced, for example, for tension in the neck, tension in the jaw. But understanding the mechanism, how it works, and this probably in 70% of the case, there's a link between our hearing system and the sound we hear. Now I wanted to ask you all, do you feel that you have any hypersensitivity to sounds? And if you could raise a hand if you feel that you have. Oh, Bill, I can't hear you. Yeah, so Sharon say yes. Debbie say yes.
Is that better?
Yeah.
Can you hear me now?
Tim say yes.
What is the question again, please?
Yeah. Oh yeah. I just wanted to, Tracy, just wanted to ask if you feel that you have any hypersensitivity to sound. If you found that loud sound are too loud. Yeah. So So we can see that. Yeah. So quite a lot of us are experiencing some sort. What is really important to remember is like this dysfunction inside, or like this what happened inside the hearing system. So this is at the cochlear level, and now we understand a little bit why this happened. what is really important to understand is your brain is going to be able to recalibrate the signal. So even though it feels too loud, sometimes we have the tendency to withdraw from situation, for example, social event or point in time where we feel that it's become overwhelming. One of the things that we are also very scared is like potentially very scared about loud environment, because we are scared that is going to impact our hearing, meaning if it impacts our hearing, it might basically impact our tinnitus. So now we understand that it's very normal, but I will encourage you to still not withdraw from loud environment. And you're going to see by exposing yourself into places where there is sound. Of course, you want to be safe. You don't want to go in a concert every days or every second week, something like that. But you don't want to withdraw yourself from places where it's where you feel that it feels a little bit too loud. And what I want to say here is like over time, your brain is going to recalibrate the signal which is sent from the cochlea. So your brain is plastic. And what happens generally is like when the hair cells are disappearing, because the brain doesn't get any signal, the brain is also amplifying. So we call that central gain. And the brain is amplifying the signal which is coming from the cochlea. And it's why it's amplifying the tinnitus. But it's also amplifying this, the sound that we found a bit loud feels too loud. By exposing yourself to this sound, you're going to see that your brain is going to recalibrate, and with time it might take months, quite a few months. But if you continue exposing yourself at relatively safe but environment which are, let's say, so 60 decibel represents the voice. 60 to 70 decibel represent the voice. 80 decibel will be going into an environment where you feel that it's loud voice. 90 decibels start to be quite loud in the sense that it will be an environment where you don't want to spend more than an hour. But what I want to say, like situation where it's around 80 decibels, the equivalent of a loud voice, a situation where you don't want to withdraw because you're going to sort of like over time, your brain is going to decrease the central gain that it has been applied, that it's initially started because of the change at the cochlear level. From now, can you tell me from a scale, and potentially using the chat, on a scale from 0 to 10, how do you feel that sensitivity to sound has been a problem? So 10 is in case it has been, and just people who felt like it has, who felt that the sensitivity to sound is a problem. If 0 is no problem at all, 10 a big problem. If you can put the numbers there, that will be a.
I have had the periacusis, and I had it up until late last year. And it calmed down completely over a period of time. So I know what it's like and how uncomfortable that can be. So my wife would watch TV, and I couldn't bear to hardly be in the room. So
yeah,
it can be quite an imposition.
Yeah. So like, and you say that this was only a few months ago. Yeah.
Well, up until about 6, 8 months ago, I had sorry, I can't say it.
Hyperacusis, yeah.
But yeah, that was very problematic for a good part of 10 months or so.
Yeah. And it's where like so I mean, thanks a lot, Stephen, for sharing. But it's where Bill, Sharon, this is going to evaluate, and so it's also for hyperacusis. It's really important not to worry too much. and decrease the worry as much as you can, because this is going to change. It's a process that takes time, as Stefan was mentioning, where it can be very, very irritating, it can be very frustrating, but over time you're going to see that it's going to get back to normal. The important aspect here is not to stop to get exposed to this sound. And over time, of course, you need to be, you don't want to to put yourself in a situation where it's uncomfortable all the time, but you don't want to withdraw completely and say, oh, I'm scared to get there because I'm scared that it's going to be loud. So being able to sort of like from time to time say, okay, I think I'm going to try today. And you're going to see that you're going to have good days, bad days, but really able to not worry too much about that, about the bad days. And I mean, Stefan is like, and I'm talking about that because it feels like it's very linked to, it's very linked to the sound, to tinnitus, basically. Now with hearing, with age, another thing that we have is like our hearing, unfortunately, our hearing is decreasing, and you can see here different. So these are audiograms for 20 years old, 40 years old, 60 and 80. And we can see in the high frequency, generally the first frequency that we lose is a high frequency. And that's very normal. And the reason is if we get back into the cochlea representation, this image, the high frequency are based at the base of the cochlea, meaning that this frequency is close to the window where the pressure from the middle ear is basically pressing. So there's a lot of pressure here, and over time, because there are more movement of the cells which are located here, this is a window which is pushing and sending the pressure inside the cochlea. And you can see because it's closer from the base, then this area at the base of the cochlea is more impacted, and is the reason why we get high frequency hearing loss. Generally, and most often, the tinnitus is going to be located in this high frequency, even though it can be variation. But this is also because of the physiology and how the cochlea is organized. So just a quick summary here about the tinnitus and hearing loss. Most people with tinnitus have some degree of hearing loss. It can be noise-induced, age-related. It can be mania disease. We also talk about ototoxic drugs. Generally, it can be frequency, like it's inside the high frequency where the hearing loss is happen, and there's something called hidden hearing loss, meaning that it might be some of you don't have a normal audiogram, meaning that you can hear, and what a normal audiogram means, it means that you can hear the soft sound. And if you remember the graph that I showed, it means that the red fibers are working normally, but there's only some of the fiber, it could be the blue one or the green one, which can be impacted. And this is a reason that we don't have a hearing loss, but we can hear the tinnitus. And in some ways, it means that there's a relation between how your ear works and basically the presence of the sound. And in these, like 20 to 30% of cases where there's no link between tinnitus and hearing loss. And then I just wanted to check here, like what you, for you all also, do you feel, and if you answer by yes or no inside the chat, do you feel that there is a link for you between a hearing loss and your tinnitus? Then just want to check if we got this 70% also inside the room. So if you feel that your tinnitus is can be linked with a hearing loss, then you can write yes. And if you feel that there is no hearing loss impacted, so team say no. Yeah. Yes. So, and probably it means that we can see we got probably the 70%, one no for 7 years, 1, 2, 3, 4, 5, for 6 years. Yeah. So it basically a good representation of the overall population. Now, sound therapy, because there is a
Sorry.
yeah.
Could I ask one question?
Of course.
Quickly? You talk about the brain's plastic, right? So you can retrain it. And with this loss of the high frequency, is there any way to reverse it? Is there any, because I know like the cochlea is damaged, but
Yeah.
is there any way to actually reverse the loss of the high frequency?
Yeah, and it's exactly what we are doing to talk about is sound therapy. And sound therapy can mean exposure using sounds, using a hearing aid. And some of you have a hearing aid, meaning that, and what the hearing aid does is basically it's going to amplify the high frequency and give some input to the cochlea. And it's exactly what you're saying, Mark. It's meaning that you're going to be able to compensate the lack of input and re-stimulate the auditory brain. And by re-stimulating the auditory brain, then you're going to see that the threshold between the sound that you hear, the tinnitus, and the external sound is going to decrease. And it's exactly, let me show this graph. So here, in case so you get a graph here with the presence of the tinnitus, which is a spike here. In case you don't amplify the sound, or if you don't provide sound therapy, you can see there's going to be like a big spike here. If you provide amplification, or if you provide sound therapy, you're going to give like some, you're going to give basically some input, and meaning that the spike here is going to be, the perception of the sound is going to be lower because the contrast is going to be decreased between the condition when you only hear the tinnitus versus the condition where you get amplification of the sound around you plus potentially sound therapy. So what we have the possibility to do is, in case you have a high frequency hearing loss, is to get hearing aids, which are going to stimulate the auditory system. And your brain is going to recalibrate. So it's not, the brain is going to decrease the central gain because it sees more input, and meaning there's not going to be the need for the brain to say, oh, okay, there's no signal, let me amplify it. And in this case, having access to sound therapy is going to be a way, in 70% of the case, to decrease the perception of the sound. And I think it's quite it's quite important to understand the reason why hearing aid and sound therapy can help. So it's like decreasing the contrast between the sound we hear and the external sound that we're going to be able to get access to.
It does work. I use it all the time.
Yeah, and so and sometimes for some of you it might not work, but it might be the reason might be that there is not a damaged hearing organ. And then, but meaning, so like Mark, 70% of you, the majority of you will benefit from sound therapy and from hearing aids. Yeah. Mark, do you use like the sound therapy? How do you feel has been working for you so far with the Zen hearing aid?
Well, the Mind Ear app I can't get it on my phone at the moment. I'm working with Matisse to reprogram my Samsung phone with it. But anyway, we'll be patient with that. I've got other apps that I can use my my sound therapy with, and it's very helpful. My tinnitus identifies with insect sounds and cicada sounds, and when I put that on, it balances it all out really nicely. So I get on with my day with that sound going, and I'm not concentrating on the tinnitus. I'm just getting on with my day because it's just cicadas in the trees. So it's just a normal occurrence.
Yeah. And as you said here, like you're probably going to decrease the contrast again by hearing this other sound, and it's going to create a mix of sounds where you're not focusing anymore only on the tinnitus sound. And Debbie, do you have a hearing aid also to provide access to sound therapy in your case?
Yes. Yeah. I wore them for nearly a year.
Yeah.
And since I've started this course, I've been able to sort of not need them so much.
Yeah.
But I just had a little question because I use the sound to sort of distract, but then there's also a function to, like you say, to use the hearing aid, because I have a very slight high frequency loss, but I don't feel like I have any hearing loss. So I've never really tried that. Do you know, like I've never really just put it on that because it just everything sounds so loud. But are you saying that because giving that a go can retrain the brain to, like, is that something I should give a go?
Yeah, that's a very good question. So like the high frequency sound that we miss, sometimes they're not really that important for speech understanding. So it meaning that I'm sure like because of your high frequency hearing loss, you might miss maybe 3% of speech. So it doesn't feel that you're missing a lot. And it means that, why will I wear it? But as you say, there's potentially a benefit to get access to this sound to re-stimulate the brain. And sort of like it's going to naturally mask or provide some masking in this frequency where the hearing damage has happened. So to answer your question, and yes, I would potentially give it a go, but it's going to be gentle with yourself because it takes a little bit of time to adapt to this high frequency amplification. Meaning that if you start wearing it, initially you're probably going to find it irritating because the high frequency sound has like the crackling, the birds. You're going to hear more of the birds. You're going to hear more of, but the paper sound. So this kind of sound is going to be very loud, and so it might feel a bit annoying. If it makes sense. But with time, you're going to see that potentially your brain is going to readjust. And this takes around at least 8 weeks to readjust. And to the point it's going to sound completely normal again, where you will not think again, like because you adapt, you habituate, and you're going to habituate to these new sounds. You will be able to sort of like completely you will not notice anymore these new sounds. And at the same time, because you are stimulating the brain in this frequency, there's a chance that there's going to be also a positive effect, a positive impact for the tinnitus.
So how long, like how many hours in a day? Because obviously, if I have that on, then I wouldn't have the sound therapy on because they're different, right? So seeing I feel like I don't need the sound therapy as much all throughout my days, maybe I can mix it up and throw this in. But
exactly.
You're saying for about 8 weeks. Are you saying 8 weeks all day?
So to start with, I will not use it all day because depends how tolerable the sound is for you. I mean, initially, you could potentially wear it 3 hours a day, something like that, just with amplification, and increase up to you until the point where you can wear the hearing aids all day. Yeah. So within 1 or 2 weeks, you might be able to get 6-7 hours, and then after that, you might be able to wear the hearing aids a full day. Now, sound therapy and hearing amplification are two different things. I think it's a very good thing to talk about today. Sound therapy is something that you might like. Debbie has been using sound therapy for around a year. And after a year, it's very common to feel that we don't need it anymore. And in some way, the sound therapy is here to help us to get some relief. So it's here to help us to feel that, okay, we can get a sound that helps us to mix the tinnitus, which is a sound which is neutral or slightly pleasant, which we can mix the tinnitus with, which help us to habituate. And because we're going to hear two sounds, our brain is not going to focus on the tinnitus sound, but it's going to get into the middle, into a place where, okay, it can start to relax a bit more, if it makes sense. And then using the sound therapy, it means that we can reach acceptation phase, and we also, in the habituation phase or acclimation phase, we can basically help us to move forward in there. Then amplification, which is slightly different, which is about re-stimulating the hearing organ in the place where there is a hearing loss, could potentially be used continuously afterwards. So ideally, in your case, and I don't have your audiogram in front of my eyes, Debbie, but it feels for me that from what you're telling me that your hearing loss is very minimal. Mm-hmm. And meaning sometime it can be a slightly advantage to have a slightly worse hearing, in the sense that you need to amplify a bit more and you feel more benefits for wearing the hearing aid. In your case, there's certain cases where you feel that the benefit of getting the hearing aid is very minimal, to the point you feel, maybe I don't need it right now, but maybe yes. And it's, there's this point where it's just in between, where you feel that, okay, but I think for you it will be a good idea to try it and try to give it a go for 8 weeks, because it's giving your brain the possibility to adapt and to feel if you have a benefit. And from the research, we see that 70% of people who are wearing hearing aids report a significant benefit of wearing it.
It is. That's true.
Any question on that? No.
No, but Fabrice, go on, Debbie.
No, I was going to ask something, but I was going to ask Fabrice, is masking the same as sound therapy? Because I've been listening to sound therapy with my hearing aids on, but I've got masking in my hearing aids. Does that make sense? So I've got masking programmed in my hearing aids, which I can put on if the tinnitus gets bad. But when I listen to sound therapy, obviously I just listen to it. I don't have it in my hearing aids as such. So there's a difference, isn't there?
Yeah, but it's a good question, Dinah. Overall, I will call that sound stimulation. And in general, the principle is going to be the same. So what you are doing, and we saw earlier that we are compensating for the lack of input inside the cochlea, and we are sending sound in order to re-stimulate the cochlea. And when we re-stimulate the cochlea, what is going to happen is we're going to decrease the central gain inside the brain. So what you are talking, it's sound therapy or masking, at the end is going to have the same, even though we call it differently, is going to have the same impact on is going to positively help you with the tinnitus.
Excellent, thank you. That's a very good answer to my question. And I was just going to also add that Nick was asking whether you can ever get the sound back. I mean, from my knowledge of the cochlea, you can never replace the hairs on the basilar membrane. That can't happen, can it?
So the hair cells are not going to reappear. And
no, they're not going to reappear.
Unfortunately, it's only certain birds who have this regeneration function. Now, before we, there's a lot of research.
Can I just ask one question? You said earlier drugs aren't good for the damaging of the hair. So are you talking about illegal drugs or drugs in general?
So certain drugs can have a negative impact. So chemotherapy drugs, for example, aspirin is another drug which can have an impact on the hearing, interestingly. So there's a certain drugs which can basically, but it's very, so all I'm talking about here are just legal drugs which are, but chemotherapy, for example, in certain drugs for chemotherapy have a negative impact, can impact basically the hearing organ, for example.
Because I'm taking quetiapine at the moment to help me sleep at night. Is that a problem with tinnitus?
No, I don't think.
Okay. Okay, that's good.
I take the same thing, and it helps me.
Yeah, I'm actually, the doctors put me on another one now because it's I'm on an antidepressant now, which actually takes my brain off the tinnitus as well, and it helps me. It's also like a sleeping tablet, so it helps me sleep and distracts me or gets my mind off the sound when I wake up in the middle of the night. If I have to go to the toilet or something like that, I can just go back to bed not thinking about it, which is helping.
And sometimes
I want to take myself slowly off those drugs, which I have before when I was at level 4 and I was just sleeping naturally. It's just a matter of getting over this spike period again.
Exactly, and it's something which is very important. When we get a spike, sometime if it's very severe, like if it's important to get the help in order to get back into a positive cycle. Getting the help of so certain drugs can be like, so I will not basically recommend any drugs here because it's very personal, and this you need to have the discussion with your doctor because we all we have all unique in and we have all a medical like all a very unique medical history, which is and the reason why I will not recommend any drugs in this discussion. But it's really important to talk to your doctor in case you feel that it has been challenging, for example, to sleep, in order to re-enter a positive cycle. And then once we are able to sort of like, of course, this course is here also to help you with any negative, like all the being able, as Dinah was basically mentioning at the beginning, being able to recognize it as a benign sound is always a start. It's really the start.
How do you manage the sound therapy if you want to try and use it at night when you go to sleep?
A very good question, and maybe that's going to be so on sound therapy we saw it reducing the contrast. Now there's no really rules in terms of how many hours you could use. Like there's no when I say like certain people will use a sound therapy all night, and there's no reason of not using it all night. It's not going to damage your ear because it's at the low level. And it's going to be lower than the sound of the tinnitus that you hear. We always want to have at a lower intensity than the sound you hear. So other people will use a timer. So they will basically use it to fall asleep and then have like a 30-minute timer to say, okay, after 30 minutes. There's no right or wrong there in the sense that it's what's going to work for you. So it's going to be a lot of trial and error in order to feel, okay, which sounds works, and then how long should I use it? In terms of sound, we all react very differently to sound. Generally, what I like to say is like, try to pick a sound that is attached to a positive memory. So if you enjoyed camping on the seaside when you were young, or if you enjoyed the sound of rain on the tent, or sound of birds because you love nature, trying to get a sound which reminds you of a positive experience in your life is always a very good starting point. And something that basically give you some reassurance or some warmth, a sense of warmth. The other possibility is to use neutral sound. And a thing that I will also recommend you to do is like the possibility to have a sound, for example, for night, which is continuously on. So some things, so if you have a speaker that you can activate and you don't touch, meaning that the sound that you have with the speaker is activated 24/7. In the sense that you don't even have to touch it to start or to stop. Even starting or stopping will basically make you think about the tinnitus. So if it's turning 24/7, at the end, this is just going to be the sound of your room, of your bedroom. And naturally, when you are going to enter the bedroom, you're going to be in a place where the contrast with the sound, with the tinnitus, is going to be lower. And to some extent, a little bit like the smell, if the sound turn 24/7, the contrast is going to decrease. It's going to be just a continuous sound which is there. And you could put, like, for example, I can give you, if you're interested about, there's some speaker which have integrated soundscape inside.
Yes, I would be. You can email them to me,
I will
Fabrice.
send it to you. It doesn't cost too much, but it could be, and also otherwise you could potentially use like a Bluetooth speaker which is connected to like one.
Do they have that? Do they have that on the? Do they have those sounds on the Mind Ear app?
Yes. So like this sounds, the speakers that I'm talking about, yes, as a different settings or different sounds that you could play, for example. So for sound therapy, generally we want to apply it in environment where it's quiet around you. So any place, office, bedroom, any environment where you feel that it's relatively quiet. And it can help you to really create an environment which makes that you notice the tinnitus less. Yeah. And with time, as Debbie said, you're probably going to be able to, within a year's time, you probably, it's not continuous, it's not something that you will have to use your entire life. At some point, you will feel potentially that you don't need it anymore. And that's completely fine. It's just because you get to the point where you have been habituating and that, okay, you're not bothered, like your brain is able to filter the sound without any help anymore. So today we talk a little bit we talk about the auditory system, and the goal was really trying to help you understand how it works. And it's not often that I don't know if you knew all this, like the cochlea sends a signal to the brain. At the end, it's remind yourself that this is just a benign spike inside the auditory nerve. There's nothing else. Nothing that is going to treat you. It's a benign sound. It's a benign spiking neural activity. And your brain will be able over time to basically decrease the amount of perception it has in you. And it's really, when we start to understand what it is, often it helps us to basically help us to stop catastrophizing on it, or like getting into like these extreme thoughts. Yeah. So any question before we finish on on this, like it was quite physiology based or neuroscience based, and maybe a little bit more boring than all the session that we had before. But I think it's important to understand how it works.
No, it's all very good, Fabrice. Thank you.
Thanks. Any questions on this topic? Oh, good.
No.
Excellent.
I am hoping that we get my Mind Ear on my phone pretty soon, because I like using the app.
We had. I don't know if you had but we had an issue with Android device. So I don't know if some of you had this issue, a login issue with Android. Some of the Android, it's not all Android phone, but some Android phone. So if you had issues, we are working on it in order to solve it, to make that, and this should be solved within days. But like sometimes technology plays with us. It's like not always all the device should be working fine, but yeah, so this is just mainly Android. Next time we will talk about cognitive behavioral therapy again, and we will also talk about metacognitive therapy, which, so in CBT, really what the goal with CBT is, when we have worries or negative thoughts, we try to challenge this negative thought and we try to reframe them in something which is neutral or more positive. And generally, from a scientific point of view, it's a strategy that works the best at a population level. So if I take 100 people doing CBT, I know that 70% of them are going to get significant benefit. And it's so that's pretty significant. And now we're going to talk also in the coming months about metacognitive therapy, which is it's a third wave in psychology. And in terms of challenging, is instead of wanting to challenge the thoughts and instead of replacing the thoughts, metacognitive therapy it's a treatment option where we allow the thoughts to be present, but recognize when there is what we call a trigger thought. Sometimes, we say, oh, I'm scared about this. Let's say when we have a trigger thought which basically create all the negative thoughts, and basically bring you into a negative spiral. In metacognitive therapy, what we want to identify these trigger thoughts, and if we know that this is going to send us into a distressing loop, we want to be able to distract ourselves, acknowledge the thoughts, not change it, but distract ourselves into something else. And so we will talk about these two techniques. You're going to see that for some of you, the CBT technique will work very well and will really help you, and we add like the stop tool already. For some of us, the metacognitive therapy option is basically working better in the sense that we don't have to change the way sometimes we feel very strongly, and we feel that we cannot change a thought. It feels like it's a truth. And then in the case of metacognitive therapy, we can just acknowledge it, observe it, but also acknowledging that if it has a negative impact on us, we can potentially change our attention into something else. And so you're going to see that learning about these two techniques, as Tim said, it's techniques that you're not only going to be able to use with tinnitus, but you will be able to use that for a lot of other things in your life in a positive way. But
yeah, that's good.
I will send you the recordings of the session. I hope that it was helpful.
Yes.
Have a lovely